My name is Tracey Schmidt-Bauer. I'm currently a director of patient care. I started with OrthoNY 30 years ago as a billing manager. I was then asked to take over our transcription department, and that's how I was introduced to DataMatrix.
Tracey, how did DataMatrix Medical customize their solutions to meet your needs?
So DataMatrix Medical actually worked with us to build an app for our physicians to be able to have the patients come into the app so the doctors could dictate. We still currently to this day use the app for surgical, although our system they don't use for office, but they do use for surgical. And the doctors found the app to be extremely helpful to show them the patient's name, the date of birth, and then that information was typed up and came back into our system.
What is it like to work with DataMatrix Medical?
Well, at any given point, I can get on the phone with Sudeep and say, I need this done immediately. And within a 2-hour period, the transcription is done and in the system. So working with other vendors through the years, I can tell you, as most of you might know, it's you either have to put a ticket in or you have to wait for a phone call back. And I can say wholeheartedly that press a number, Sudeep's on the phone, and or an email, and it's taken care of immediately. That is one thing that even the doctors have appreciated, knowing that they are very dependable and they're very happy with. And we wouldn't be with them for 15 years if they were not.
How compatible is DataMatrix Medical with your processes and procedures?
I think I definitely like that we co-source with DataMatrix Medical and their team of people. They really feel like an extension of OrthoNY, and they're able to be trained if they don't know something. We can teams with them and teach them what they need to learn. And I think that's important because training even a new employee is usually a 3-month period that you're training them to learn your system. And just working with Sudeep and his team, any questions that they have, they come back, ask me, we take care of it. And I think it's been 2 different systems that we used. They've picked up very quickly, very familiar with many different systems, and their turnaround time is quick.
How can a prior authorization service positively impact a practice like OrthoNY?
So the authorization process, as many medical offices know, is a nightmare. You're dependent on websites, you're dependent on phone calls to get your authorizations. But on the flip side of that, it's also your doctor's dictation to make sure that everything is there for you to do the authorization. So it is really having that trust with who you work with to ensure that they're communicating back if something's missing that they need to get the authorization. Unfortunately, there's no quick way to do authorizations. It is a process, but as you grow in a practice, it's hard to staff cost-wise, that you have to keep adding more staff, where we can send it to DataMatrix for probably half the cost of what we would pay a full-time employee and not have to pay benefits. So I think the convenience of that and the knowledge that they have is priceless.